All right, guys, good morning. Luis Moreno here, Simply Health Insurance Agency. I ran a scenario today, and it's a common question that I get from agents, but I actually did it myself for one of my clients. The question was healthy individual. Here's the scenario. Healthy individual, young guy, is wondering, should I get ACA? Should I get a short-term policy? What are the pros and cons? And guys, I'm going to explain that to you as soon as you give me some love. All right, make sure you like this channel, make sure you subscribe to it, or like the video, subscribe to my channel, and guys, comment away. I respond to every single comment myself. I don't have an army of assistants to get it done, so you were here for me. All right, so short-term medical, ACA, which one? It's a big question, guys. It depends. So let's look at the actual scenario, and then I will give you the pros and cons. All right, here we go. All right, so I ran now here's the other scenario with this individual, which is also a huge factor that you've got to utilize, and that is income. So this guy is making some really, really good money. He's a young guy. Was born in 1999. Now, what does that make him? That makes him 24 years old. All right, he's making about $250,000 a year. He's doing super well. Okay, there are some factors here that you have got to take into consideration. All right, factor number one, of course, is income. You're probably wondering, well, what does income have to do with this? Well, depending on the amount of income that they have, they could get subsidies to help with the premium, and they could also get cost sharing reductions to reduce the deductible, the coinsurance, the out-of-pocket maximum, and copays. All right, so again, it's a big depends. Also, the other factor is going to be their health. Okay, if you've got somebody that is unhealthy, okay, they've got some pre-existing conditions, you may have no choice but to go one way or the other. All right, so you've got some things you got to look at. Now, this individual, high income, super healthy, and their objective with this is they just want some protection if something major happens. All right, so that's one scenario. Okay, that scenario led me to put him into a short-term medical plan. Okay, now if the circumstances were a little bit different, let's say this individual had some pre-existing conditions, right? Well, depending on those conditions, if they're serious, he may have not been able to get into a short-term plan because short-term plans are fully underwritten. You have some health questions that got to be answered. I'm going to share those questions with you right now. All right, here are the questions, guys. Sorry, just had to get that ready. All right, so here are the questions. So this is general information questions that I see. During the past 5 years, has the applicant been declined for insurance by a carrier other than Golden Rule? Okay, due to health reasons. Okay, the answer to this question for my client was no. Has the applicant lived in the 50 states of the USA or the DC for less than the last 12 months? Okay, he has not lived less than 12 months in the US. So that's no. During the past 12 months, has an applicant smoked cigarettes or e-cigarettes or used tobacco? And the answer to that one was no. Okay, the next question. All right, I'm going to pull up the next one. Sorry, guys, thought these things preload for me, but obviously they are not. Okay, the next set of questions is going to be, here we go, medical questions. So on the medical questions, it is this. Is the applicant currently pregnant, an expected parent, in the process of adopting a child, or undergoing infertility treatment? If yes, coverage cannot be issued. In my scenario for this insured, the answer is no. Within the last 5 years, has the applicant received medical or serological consultation, advice, or treatment, including medication for any of the following? blood disorders, liver disorders, kidney disorders, and all those list of medications. Okay, or conditions. The answer is no. Okay, let's go to the next one. Next one here is during the past 12 months, has the applicant been advised to undergo any test except for an HIV test, treatment, hospitalization, or surgery which has not been completed or for which the results have not been received? Next question, within the last 5 years, has the applicant received treatment, advice, medication, or surgical, geez, I can't believe I said that wrong. Surgical consultation for HIV infection from a doctor or other licensed clinical professional, or had a positive test for HIV infection performed by a doctor or other licensed or clinical professional? The answer in this scenario was no. All right, then we go to the final question. Final questions are, okay, here are the final questions. On this one is, does the applicant have, or is any applicant currently applying for other hospital or medical expense insurance that will not terminate prior to the requested effective date? In other words, you can't have double coverage. For applicants with current short-term medical with us, does the applicant currently have a short-term limited duration medical insurance coverage with Golden Rule that will not terminate prior to the requested effective date? All right, and that is a no for me. All right, pretty easy, guys. The answer to those, you're rocking and rolling. All right, let's actually look at the rates. All right, so let's go to rates here. Let me get that ready. Clicking away, so many screens. Okay, here we go, guys. All right, so I'm going to quote this guy a bronze plan. Okay, I'm going to go here to this bronze one. This is an ACA plan. It's $224. Their deductible $7,500. They got a few doctors here. They've got some generic drugs, $25, and then he's got a maximum out of pocket of $9,000. So his worst case scenario here is $9,000. Okay, not too bad of a plan here. All right, now here's where it matters. Remember, we talked about some factors. Let's say his income was $25,000. Okay, well, at that point, I would go to a silver plan. Now look at the premium. It would make no sense for me to offer this individual a short-term plan. Why would I want to do that? In this scenario, no sense. Okay, we have an Aetna plan here, $24 a month, out of pocket $3,000. Okay, so with the income, I wouldn't even consider a short-term medical plan for this individual. Okay, this is just too good to pass up. Okay, but let's go back to the 250,000, and we'll go back over here to the bronze plan. All right, here is I like using United Healthcare, guys. They've got a large PPO national network that I like, and there's different plans that you can use. So I've entered this individual's information here. I like using the elite plan. Okay, that's just me. Okay, let's go in here and we'll add the plans to the cart. Okay, it's working its way through here. And what I will do, let's see here. For some reason it's not working. I'm going to do it again here. Always good to have some technology issues. All right, so it looks like it logged me out. Give me 1 minute, guys. I'm going to log back in. I think I spent too much time. Let's go here. Okay. Got to verify my identity. It happens. All right, here we go. Now we're back in. Go back to sharing. All right, we're going to get a quote. $209. We got a male, 07/17, 1999. We got no spouse and no kids. All right, we're going to choose this short-term medical plus elite. That's just, it's so easy for me to explain, guys, and that's usually what I stick with. All right, there we go. Now we're rocking. All right, so for this individual, what we did is we're going to edit the details here. I'm changing his deductible to 5,000. Okay, and then I am also going to add the 24/7 over the phone video doctor visits. Okay, I'm at 225. Okay, so remember, I'm at 224 over here. I'm at 225 over here. Here's the big difference, guys. Now, he does have doctor copays. He does have prescription copays. This individual is not taking any, he's not seeing any doctors. He's a young, healthy kid. All right. Occasionally I would assume, let's just say the guy got a sinus infection, or, you know, he could handle small things through that virtual doc. He just doesn't need it. Okay. He's also got some drug benefits over here with the short-term, with the ACA plan. But let's go look and see what he's going to get here with his short-term medical. I'm going to pull up the brochure. The one thing that I do like about UHC is this thing that I'm going to point out here. As soon as it loads up, come on, baby, let's go internet. Okay, check it out here. So we're going to go to the elite, which is right here. The good thing I like about the elite is that it's 100% plan. Okay, which means after they meet their deductible of whatever you choose, and in this case I chose $5,000, then after that he's got 100% coinsurance, which means he's on the hook for $5,000 and that's it. Okay, he's got a $2 million cap on the maximum benefit. Okay, with the ACA there is no cap, so you got to weigh that out. But again, in my scenario, we're good. Now, what I do like is there are no doctor copays here, but if he needs to go see an urgent care, all right, he's got a $50 copay. That's not too bad. Okay, it's really not a bad deal. Now, there is a copay for prescriptions here, tier 1 prescriptions. Okay, tier 2 through 4, there is no copay, but once he's met his deductible, then he's rocking. There'll be no charges for that, for those medications on tiers 2 through 4. But tier 1, $25 copay. It's really not a bad benefit. So I've kind of put this here for him in $0 video doctor costs, which is not bad. I do these all the time. So for this scenario, guys, I went ahead and recommended this plan. He was at $225. It's a $5,000 deductible, 100% coinsurance, 6-month duration. Now, I'll tell you this, when you go beyond the 6 months, guys, the rate goes up significantly. Okay, now let me go back in here and show you that. So if you go in here and you edit the details, and let's say you're going to go 12 months. It's not a full 12 months. It's 1 day short of a year. But look what happens to the premium. It goes from 225. Well, in this case, it's not that bad, 289. Okay, I've seen it go up quite a bit, but you know, not bad for a 12-month period. Okay, in fact, knowing this now, I may get back with them and say, hey, why don't we just bump it up? They probably will not, since this guy's pretty healthy and they're going to want to keep it at a lower premium. But that's really not a bad idea. So in summary, guys, short-term medical versus ACA. Remember, it's not clear cut. Okay, there are some dividing lines here. There are some factors that you got to determine. Number one, before anything, I would look at health. Okay, get an idea of what their health looks like. Okay, if they're unhealthy, if they got some health conditions, pretty much you're going to eliminate the short-term option. Okay, all right, but if they're healthy, then you've got both of them to think about. The next factor that I would look at is income. All right, if income is super high, they're not going to get any subsidies and no CSRs, then the short term may look pretty good. Okay, you know, it just depends. run that. If income is pretty low, what you saw earlier, it doesn't even make any sense to offer a short-term medical when they can get a premium, a lower plan through the ACA exchange and get lower deductibles, lower coinsurance, lower out-of-pocket maximum, and lower copays. The one that I illustrated there, you know, his rate dropped down to $25 and his maximum out-of-pocket was $3,000. So you really can't beat that. So if you're out there, guys, a couple of things I have for you. Okay, you're out there and you wanted to do this, but maybe you don't have carriers. Let me know, guys. Number one, if you do not have United Healthcare, it's underwritten by Golden Rule. Okay, but if you do not have United Healthcare, their short-term medical product, guys, down below, I'm going to have my email. Hit me up. Okay, I'll send you contracting for United Healthcare. Okay, the other deal, if you're wanting to sell ACA, okay, well, I'm going to backtrack a little bit to the short term. On the short term, they have to be U.S. citizens. They have to live here for 12 months. Okay, now, if you're dealing with somebody who's not a U.S. citizen, I have another carrier for you. Hit me up on my email and I can set you up with that carrier. It's another short-term product for them. Okay, on the ACA side, if you're wanting to sell ACA, but you're like, I don't know where to go, you know, I want to get not only contracted, but I want training and I want support, I'm your guy. Send me an email and I will get you set up. Also down below, click on those links, guys. Click on the more. I've got, if you're already set up with somebody, but your training is horrible, you're getting no support, and for some crazy reason you still want to stay there, all right, let it be what it be. But I've got an ACA 101 course that you can purchase. I've also got my CRM that I love. I've got an incredible CRM with some awesome workflows. I've got that down below. And then the third thing, one of the things a lot of clients, a lot of agents ask me, I do share that I wrote almost 1,400 new business applications during the open enrollment this past year. 90% of those leads came from Facebook. So it's an incredible thing. So anyway, guys, so click down there and you'll get that. Again, thank you. Don't forget to like this video, comment, please, and subscribe to my channel. Thank you, guys.